Today, people around the world are observing International Workers' Day, also known as Labor Day or May Day in other jurisdictions. Though in Bermuda, we celebrate labor later in the year, I want to acknowledge the workers of Bermuda and the global struggle for better work conditions, better wages, and better lives for all. I commend our island's unions and their members for the contribution you have made over the years and the contribution you continue to make for the betterment of our community. From the start of this national health crisis, we have sought to be as bipartisan and inclusive as possible, as we believe that not only do many hands make light work, but many minds working together on our collective problem is likely to produce better outcomes for all. COVID-19 does not care if or how you vote, and at this time, neither should we. In perhaps what is a first in modern Bermuda history, I'm joined at an official government press conference by the Leader of the Opposition, Mr. Craig Cannonier, who will be addressing you as well as the Minister of Health and the Minister of Education. The Minister of National Security, without his dog this afternoon, is also here to answer any questions that you may have regarding the enforcement of our new rules in Phase 1. First, I would like to ask the Minister of Health to provide an update on COVID-19 cases in Bermuda and the work being carried out by the Ministry of Health. Minister?
Thank you, Premier. Good evening. Today, there were 207 test results received by the Ministry of Health. None were positive for COVID-19. Bermuda continues to have 114 total confirmed positive cases. Their status is as follows. There are 60 active cases, of which 44 persons are under active public health monitoring and 16 persons are hospitalized, including a number of 48 have now been totally recovered, and the deceased totals remains at 6. I realize that there are some members of the media that have a great appetite for intimate details about patients, including how many are on ICU or on ventilators. And these are small numbers of people who, as you can imagine, can easily become identifiable in a small community such as ours. And so I ask you, if that was one of your loved ones, would you like that personal information to be discussed in the press? I know for me, I wouldn't want that, and I suspect you wouldn't either. So while I can tell you that there are 4 COVID patients currently on ICU, because that is in the public domain, this is not a figure that we will be reporting routinely out of respect for those patients and their families. And I ask that you refrain from seeking further details on such small numbers of identifiable people. And I thank you for your understanding and cooperation. The average age of all of our confirmed positive cases is 60, and the age range of all of our positive cases is from 18 years to 95 years. The age of persons hospitalized ranges between 57 and 91 years, and the average age is 76. Just under 2,800 people have now been tested for COVID-19. This represents 4% of our population, and it is an excellent rate compared to other regional jurisdictions and our region overall, placing us amongst the top 10 of the world in testing. Aggressive testing will continue next week, prioritizing physician referrals, contacts, nursing homes, and essential workers, including public officers. The drive-through facility will operate daily from 2 p.m. to 7 p.m. And as I mentioned before, the increased island's testing capability does mean that we can have more people tested and retested who had previously tested positive for COVID-19 to ensure that they no longer are carrying the virus. And this is great news that we should all be proud of. I'm sure many of us eagerly are awaiting the lifting of the sheltering in place tomorrow morning. But please, as the Premier and I have already said, this does not mean that everything goes back to normal. We are not out of the woods yet, and testing does not make us safe. I'm increasingly worried that I hear people of all ages, young and old, are already planning parties and gatherings tomorrow. Please don't. People still need to avoid moving about and congregating with different households as much as possible. The fact that we have more freedom of movement now does not mean that we can move freely as if COVID-19 did not ever exist. COVID-19 is still with us and will be with us for the foreseeable future. So avoid gatherings, avoid mixing households, and avoid moving around unnecessarily. The more we move around, the more we expose ourselves and others. The more people we have contact with, the more risk of contacting COVID or transmitting it to other persons. So do not see the end of shelter in place as the green light to start partying and heavy socializing. It is merely an amber light to proceed with caution, physically distant, masked, and in small groups. It's probably worth noting that we are shifting our language, Minister Keynes, from social distancing to physical distance. This is to emphasize the protective measures that staying 6 feet or 2 meters apart offers in preventing COVID spread. And likewise, wearing a mask and minimizing congregating and movement serve to create physical distance between people to prevent transmission. And the point is to be physically separated, not socially isolated. This is important as we move through our gradual phases of reopening and transitioning to our new normal. The Premier has already outlined the precise stipulations of how we will proceed in phase one of the reopening, and hopefully everyone has had time to absorb the information and will abide by the restrictions. How will we know if we aren't? Well, among other things, we will see a rise in hospital admissions for the virus or signs of community transmission, which the island has avoided so far. If this happens, we will have to start looking at suppression measures again, including recommending a return to the shelter in place to bring COVID under control once again. As we start to remove our movement limitations, I would like to remind the public that this is actually vaccination week in the Americas. And unfortunately, we do not yet have an effective vaccine for COVID-19. And until a vaccine for COVID-19 is available, immunizations can and must be delivered by our health services alongside the response to COVID-19. And here's why. First, we must vaccinate to protect our health workers, the elderly, and vulnerable populations from other respiratory infections such as influenza and pneumococcus, which can lead to more hospitalizations and may be harder to diagnose in the context of COVID-19. Second, if we fall behind on routine immunizations, particularly for children, we risk outbreaks, thus overwhelming hospitals and clinics with preventable diseases in addition to COVID-19. And the impact on our health system would take months or even years to reverse. Remember, ICU capability and capacity is among the factors that would determine if our hospital could cope if COVID-19 cases were to increase sharply. COVID-19 is putting our health systems to the test. Going forward, the challenge is to ensure that our health systems deliver on our priority health programs, even while responding to COVID-19, which is why we also want to continue to encourage persons with non-communicable diseases such as diabetes, hypertension, and COPD to manage their conditions as much as they can so that they do not end up in the emergency room. In addition to physical distancing to prevent COVID, technology is going to be a big part on how we stay informed and monitor our health. And in this vein, I am pleased to highlight the Bermuda Health Council's establishment of an online health monitoring tool called Health IQ. The Health Council worked with young local talent Gabriel Jones, who's an 18-year-old student from Saltus, and a seasoned software engineer, Mr. Lee MacArthur, to launch Health IQ, which will help us as a community to track symptoms based on COVID criteria. It will also provide users with individualized information and follow-up by professionals based on various risk factors, such as those that are medically vulnerable, and track trends and gaps so that we can better identify places where partners like donors and our third sector can focus their resources. This data is very important as we plan for and transition from phase 1 to phase 2 to phase 3 and to phase 4. This data will make sure we are informed so that we do not skip vital steps in our recovery and are not forced to start back from square one. By having this critical data, the Health Council will be able to support the ministry's incident command team and the contact tracers in their work to identify and contact persons if they are feeling unwell and provide support and advice on what to do. Health IQ will also provide the island with more insight into the potential cases of COVID-19, and it give us a proactive way to address them, giving us tens of thousands of eyes so that we can all stay safe. As we have seen in other countries such as South Korea, the more information known about the community, the better decisions the population can make about their movement and the public health measures that they must adopt. We are asking that each household go to healthiq.bm and enter your information immediately and update it often. This is especially important as we start to head out of our homes more. We need all 64,000 residents represented in this data so that all of our 64,000 persons can also move forward together. Give yourself and your community a better understanding on how we are all doing. As I wrap up, I would like to remind all food businesses that are opening tomorrow that they must ensure that their premises are fully cleaned and pest-free before opening. A guidance note in this regard can be located at coronavirus.gov.bm. In closing, I would like to remind you to continue with physical distancing. Keep 6 feet away from persons, wear a mask in public places, practice respiratory hygiene, and wash your hands frequently with soap and water for no less than 20 seconds. Thank you very much.
Thank you very much, Minister of Health. And I think that it is refreshing to note that, as you said in your comments, that Bermuda, as a percentage of population tested, is now in the top 10% of the world. And that is a massive accomplishment over the last weeks where we've been able to ramp up our testing capacity. And I am grateful for the efforts of all persons who've been involved in that particular effort. As the Minister of Health ended on the technology solutions that are going to be launched to assist us in our battle with COVID, I do want to expand a little bit on those particular matters, as some of these also lie with myself as the minister responsible for technology for the government of Bermuda. And I just want persons to know that we are evaluating a wide array of options, and our goal is to leverage technology as a tool to assist in reopening our economy as quickly as possible, but while minimizing the risks of the spread of this virus. Now, managing this is certainly something that is complex, and we need to make sure that we can use technology to effectively understand and evaluate trends of symptoms that can indicate a further spread, understand the movement, flows, and congregation of people as an aggregated group, not as individuals, to better understand the risks, to continue to aggressively test our essential workers, and to make sure that when, in any case, that there's a positive case, we can assist persons in identifying their contacts so that we can isolate those cases and ensure that those persons can also be tested. What is most important from a technology perspective is the anonymous interactions that we are exploring potential community technology solutions to address, where cell phone-based apps can help, but they also require a large segment of the population using them to be effective. Therefore, it is essential that we focus driving that level of confidence in any choice that the government makes going forward. Any solution that we must have has to put privacy first. If not, it will not be successful. Beyond that, we are looking for solutions that are cost-effective, have active development communities, and have a limited requirement for technical resources and are compatible across all jurisdictions as we look to eventually open our borders. While some countries like Singapore and Australia have rushed to launch apps, there are well-documented challenges. Others are waiting on Apple and Google, who have announced APIs that will allow for more efficient apps to be developed, which will put less burden on individuals' devices and also encourage greater participation. We are exploring a number of key areas to address these challenges and have actually completed some of them. First is the self-symptom reporting tool being launched by the Bermuda Health Council, which the Minister of Health just addressed. Second is the record-keeping solution to assist the efforts of the contact tracing team, which is the Go Data platform, which the Minister of Health has also said has been brought live. Third is a GPS location tracking app for essential services workers who interact with at-risk individuals to quickly recall where they went and who they interacted with should they become affected. And that is something that will be able to be piloted next week. And then finally, a Bluetooth contact tracing solution to better manage anonymous interactions. Here's what's important, and it's important that we recognize the difference between the two apps, the GPS-based apps and the Bluetooth apps. GPS apps can tell you where your phone is or was at a certain point in time. Bluetooth apps can tell you how close your phone is to another phone that may be running the same app. These sorts of technology solutions are not magic fixes. They are tools that can be leveraged by our teams to better provide insights to support their particular efforts. We continue to explore and evaluate the possible solutions so that we can fulfill our goal of opening our economy as quickly as possible while mitigating any risks. And certainly, technology that can help us track and trace will be a key tool in that endeavor. However, it is essential that persons in Bermuda understand that these solutions are being evaluated carefully, and as we need your participation in order for this to be a success, we are not rushing to any solution, and we're only going to implement a solution that can be certain, that can protect individuals' privacies. We are working as quickly as possible on these particular solutions, and we'll be pleased to update you in the future. Right now, the team consists of Dennis Pitcher, who is the Chief FinTech Advisor, Martin Walsh, who is working in the Information Development, the IDT team inside of government, and we're also working with overseas universities and a place to look to pilot a particular application here in Bermuda. So that is the update for that. Now I will say that before we go to the Minister of Education, as shelter in place ends tomorrow, we will enter phase one of the careful reopening of our economy. This is important to get our country moving again and getting some persons back to work. While schools will not be reopening at this phase, as we recognize that we cannot send our people fully back to work if our students are unable to return to school. Today, the Minister of Education will provide an update on education and the work ahead. Minister?
Thank you, Premier. In our efforts to keep the general public informed, and specifically our education family, this evening I will be providing updates on both the Department of Education and Bermuda College matters for our students, educators, parents, and guardians. Prior to the updates, let me say that today is Principal Appreciation Day. And at this time, I want to acknowledge and thank our educational leaders in both the private and public school systems for their commitment to the education of our children. Their leadership is applauded through this unprecedented time, and we say thank you. I'll begin by sharing brief updates for the Department of Education covering remote learning, provision of laptops, preparation for school building openings, graduation requirements, and student transcripts. Remote learning. On Wednesday this week, the Honorable Premier announced in his press statement that after lifting the shelter in place, all school buildings will remain closed. This means that next week, our schools will continue with remote learning until the decision is made for school buildings to be reopened. I applaud the Trojan efforts of our principals, our teachers, and staff as they deliver remote learning experiences to our students. I have seen several videos and WhatsApp messages that are being circulated, and that I must say that there are amazing learning experiences happening for our students at all levels of the education system. Using Zoom as the major technology tool, schools are holding weekly student assemblies. In some instances, our students are leading out. Morning meetings are held as well as circle times with students. Teachers are delivering lessons in real time. They are also sharing pre-recorded lessons and providing a variety of stimulating activities in all subject areas, including science experiments. Students are receiving small group instruction with learning support teachers and reading teachers joining in sessions with their students during their class or individually scheduled times. Students are uploading videos, pictures, and other evidence to confirm what they are learning and what they can do. Students are also receiving services from educational therapists, paraeducators, and school counselors. I'm pleased that some of our parents are engaged in conferences MTSS sessions, and some parents have participated in Zoom chat and choose. There are some principals who are teaching classes, and one principal has even launched a YouTube channel to read aloud time with students. As we close out the month of April, which was Autism Month, I commend the teachers in our pre-primary, middle, and senior schools who deliver the autism program for our students with autism. They too are using Zoom to provide interactive lessons and appropriate sensory activities for our students. As parents adjust to the steady demands of remote learning, providing support is critical. I next extend my gratitude to Mirrors, who is assisting and coordinating donations for laptops for students, and with supporting parents through their Parent Connect program. Parents who are seeking support with navigating Zoom and the remote learning experience can use the Bermuda Public School System's Families Electronic Feedback Form to access the support. The link to the form will be sent to parents again next week. Laptops for teachers and students. Last week, the Department of Education's IT team prepared laptops donated by PwC for distribution to some of our teachers. We are very grateful to PwC for the donation of 90 laptops. These were delivered this week to 59 teachers with the assistance of the staff of the Ministry of Public Works. The delivery of the remaining laptops will continue next week. I also extend my gratitude to the Bank of Bermuda Foundation for providing laptops to some of our students and teachers, roughly valued at $34,000. There are 21 students at the Barclay Institute, 10 students and 7 teachers at the Delwood Middle School who have received laptops. I next want to acknowledge the CEO, Mr. Frank Amaral of One Communications Limited. Mr. Amaral contacted Cedar Bridge Academy to offer free Wi-Fi hotspots for students without internet. These devices will enable students to participate in the school's remote learning program for the remainder of the online learning experience. One Communications Limited has provided over 60 devices for public schools, with Cedar Bridge Academy receiving 22 devices for our senior school students. I thank Mr. Frank Amaral and One Communications Limited for their generous donation and support of students in the Bermuda public school system. Also, Bermuda-based Legal and General Reinsurance will be launching a Lighthouse Connect Fund to raise monies to purchase free laptops for public school students. Legal and General have already provided an initial contribution to the fund. The laptops will be procured in stages as funds are raised, and the distribution of laptops will then be managed by Mirrors program in conjunction with the Department of Education. We thank the CEO of Legal and General Reinsurance, Mr. Thomas Olonlu Yo. The generous donations from PwC, the Bank of Bermuda Foundation, One Communications Limited, and Legal and General Reinsurance will certainly strengthen the remote learning program and ultimately benefit all of our students and teachers. Now I'd like to turn my attention to preparing for school building reopening. Although there is no fixed date when our schools will reopen, there is still the need to be positioned and ready for effective delivery of classroom teaching and learning. Therefore, technical officers at the Department of Education, led by the Commissioner of Education, have had several planning meetings preparing for the reopening of school buildings. Department staff have been working closely with the Ministry of Health representatives who have provided extensive guidelines and technical support on health and safety protocols that must be implemented when school buildings open. A draft plan of considerations for opening school buildings was developed with components detailing the various protocols required. On Wednesday this week, we held a meeting with all 3 union stakeholders, the BIU, the BPSU, and the BUT. We are pleased that the president of each of these unions participated. There is much exchange, including comments, feedback on the draft plan, and recommendations for improvement. The components of the draft plan were also shared with our school leaders in a meeting held yesterday. The information received will help in finalizing the school building reopening plan. Graduation requirements. We've received questions from our students and parents about graduation requirements and obtaining school transcripts for universities, scholarships, and award applications. At this time, I want to personally inform our S4 senior school students, our parents, and the educational community that I have agreed to the recommendations made to revise some of the requirements for our high school diplomas in light of the ongoing COVID-19 crisis. These changes will affect both the Bermuda School Diploma and the Bermuda Alternative School Diploma and are applicable for the June 2020 cohort only. Our senior school students transitioned to remote learning on March 19th as a result of the closure of school buildings. Additionally, the shelter in place impacted many students' ability to complete all the requirements for graduation, which included the required hours for community service, co-curricular hours, and work placement activities. Therefore, I have agreed that the minimum requirement for community service, co-curricular activities, and work experience will be waived where normally applicable. All other graduation requirements remain in place. That is, for the Bermuda's High School Diploma and the Bermuda Alternative School Diploma, students must still meet the minimum requirements for course credits, grade point average, and school attendance. The revision to the diploma requirements apply only to those criteria impacted by COVID-19. I am satisfied that the revisions are reasonable and will not compromise the academic standard or currency of each diploma. I thank our senior school principals and staff for the collaborative efforts to facilitate remote learning for our students. I also wish our S4 students well in their efforts to meet the requirements for their respective graduation diplomas. As our students prepare for after high school experiences, I want to ensure that they are clear about the process of securing transcripts. Each senior school has designated a member of staff who is responsible for responding to requests for transcripts. As a first step, students should email requests for transcripts to Ms. Nicole Crockle at the Barclay Institute or Ms. Champagne Kane at the Cedar Bridge Academy. Once the transcript verification process is completed for a student, staff members at each of their respective schools will complete the transcript request form and submit it to the Department of Education. Once received by schools, transcript requests will be completed within 5 days. Former students of the Bermuda Public School System who require transcripts will need to complete the relevant form, which can be found on the Ministry of Education's website, www.moed.bm. Requests for transcripts from former students will be filled within 3 business days. Before moving on to the Bermuda College, I'd like to provide a brief update on the Ministry of Education's scholarships and awards offerings to let applicants know that the deadline has been extended to Thursday, May 7th. I know many of you are operating under difficult circumstances, but I encourage those who are pursuing post-secondary education to find time to complete those applications. Upon reviewing the number of applications received this morning, we noted the number of applicants submitted is lower than that of last year for all categories, with the exception of 2. So with the extended deadline, this gives time for applicants to still submit applications. Anyone with questions or concerns should email scholarships@moed.bm for assistance. And I want to thank those who have completed our scholarship survey and shared how COVID-19 has impacted plan studies and or your ability to complete the application process. We received 108 survey responses, which are currently being analyzed. These results will help us to better support applicants and our upcoming scholarship recipients. Now I would like to turn to Bermuda College. On March 23rd, just after the first positive case of the virus was reported in Bermuda, the Bermuda College closed its campus and moved its classes online, while its employees began to work remotely from home. However, during the past 5 weeks, some of the creative and innovative activities that have occurred include virtual science labs and field trips, culinary arts students conducting labs in their own kitchens supported virtually by their instructors, Zoom lectures, group discussions, and musical performances. Students in the environmental studies even sponsored an online trashathon show using completely recyclable materials. To continue unparalleled support for students, counseling services, academic advising, and tutoring have all continued virtually. Let me extend my gratitude to the faculty and staff at Bermuda College who have ably risen to the challenge of reverting to an e-learning platform with little notice and who have innovatively facilitated the success of student learning. Unfortunately, like many of its overseas counterparts, the Bermuda College has decided not to hold a commencement ceremony this year as a result of COVID-19. They will be celebrating the class of 2020 at a future date. However, the college will be putting a plan in place so graduates can collect their certificates, diplomas, and associate's degrees on May 28, 2020. Summer school at the Bermuda College, that is due to start on May 18th, will now start June 1st, and all courses will be online. The course schedule for the academic and professional development courses will be available at the college website, www.college.bm, on May 5th. This is an opportune time to learn new skills, expand your resume, and develop your personal and professional worth. With its international accreditations, students from overseas institutions can take summer courses to decrease their course load for the fall term. We encourage students and adults alike to discover new course areas such as fintech, data analysis, project management, and managing remote teams that are particularly pertinent during these times. I'm particularly pleased to note that the PACE division will be offering the Certificate for Nursing Assistance program online as well. This is both timely and relevant because of the critical and immediate need for healthcare professionals. As a way of assisting the community during these unprecedented times, Bermuda College is also inviting the community to take advantage of its online training resource, Who Knew It? There's a wide variety of tutorials available covering software and technology, goal setting, time management, and teaching and instructional resources. This resource will be offered to the community at no charge from May 5th until September 1st. The registration form will be available at the Bermuda College website on May 5th. Finally, the Bermuda College is considering various options for the next academic year and will be making a decision about its fall semester courses in early June. For further details on programs and courses, please visit the website, again, www.college.bm. As I close, I commend the Bermuda College students for their hard work in adapting to remote learning under these circumstances and encourage them to continue their studies in the summer and fall. I also want to thank the Bermuda College employees for all that they've been doing during this and what they're doing to ensure tertiary education continues during this pandemic. Thank you. Thank you, Mr. Premier.
Thank you very much, Minister of Education. As mentioned previously, we are joined today by the Leader of the Opposition, the Honorable Craig Cannoneer. During this period of national crisis, it's important for the people of Bermuda to know, feel, and understand that both sides of the political divide are working together for the good of the country. Following our meeting on Monday, I've invited the opposition leader to say some words to Bermuda. Opposition leader.
Thank you very much, Premier. Good evening, Bermuda. I want to give great thanks to the Premier for this opportunity that we have this evening to sit at the table in a bipartisan approach to a virus that seeks to annihilate us. One of the things that I am clear about concerning this virus is it's after our most precious resource, and that is you, Bermuda. What I am clear about this virus is that it also seeks to destroy our economy. What it has clearly highlighted, however, is our need for each other. And so again, I thank the Premier for this opportunity, because only together will we get through this as best we can. My presence here this evening marks the Premier and myself's commitment to seek every opportunity we can to fight this virus. And clearly you have seen that we are in uncharted waters. And so leadership many times will not be spared the scathing of criticism. But what is clear is that we as a people must stick together to eradicate this very thing called COVID-19 that seeks to destroy each and every one of us. So again, I say thank you to the conversations, to our Premier, to the conversations that we have had. I want to say thank you for the opportunities and agreeing that I could sit at the table to show you, Bermuda, that there is hope at the end of this tunnel, that we can come together and fight this thing. This COVID has caused us to question our politics. It has caused us to question our economy, and it has caused us to question our priorities. And so as the Premier and myself continue to walk through and have discussions, we may not always agree, but what we have agreed to do is ensure that the line of communication is open and that we will do everything possible to create an environment of safety and to lessen the pain that we are going through. I've had the opportunity and spoke to the Premier about the fact that I'm out on a daily basis delivering meals. And it is clear that this virus has pointed out that we have some challenges that we must face as a people. There are far too many people still hurting. And together, I believe that we will find the solutions to ensure that anytime anyone is under threat, that it will get a bipartisan approach to dealing with these situations. And so to our emergency services, I want to say thank you. The conversations that we have been great. And I know it is not always easy when we are serving one another. We can be pretty tough on one another at times. I recognize that there is true, real fear out there because lives are at stake. And so together, I believe and I know that we will solve the challenge. We must continue to aggressively quarantine, test, and trace. And as the health minister has said, in addition to that, we must follow the guidelines that have been set out before us. If it is required in an environment for you to wear your mask, you must wear your mask. If it is an environment where you must wear gloves and you need to socially distance yourself, you must follow these guidelines. It is our future that is at stake. And so once again, I'm grateful. I know I don't want to take up too much time as we move through. We have regulations that we're about to go through this evening, but I want to thank the Premier and Bermuda U for the calls and the conversations and the questions. And I'm sure that the Premier is scratching his head some nights when we're up at midnight and I'm forcing through and pushing through questions to him. There is truly an effort being made to ensure that we get to the resolution of getting Bermuda back to its normalcy as best as possible. But bear this in mind, Bermuda and the rest of the world will not be the same after this virus. The new norm will not be before January. It will change. And I'm here to support every minister and the work that they do, the cabinet and the Premier, as we move forward, asking questions, and many times tough questions, but they must be asked because the benefit of Bermuda truly resides in us working together. Thank you, Premier.
Thank you, Opposition Leader. And I do know that there are a few persons questioning why I'm wearing red today. No, it was not at the invitation of the Opposition Leader. It was actually at the invitation of the President of the Bermuda Public Services Union, as red is the color for International Workers' Day. So I don't want anyone to be confused there. But thank you, Leader of the Opposition. We are working together, and we're going to continue to work together. And as we have laid out, trusting each other is not the easiest thing to do, but the country needs to see that we can work together during this very difficult time and challenging time for the country. And I think that we are making progress in that regard. Shelter in place ends tomorrow at 6 a.m. and we move into phase one. How long we will be in phase one and how long it will take us to move to phase two will be up to each and every one of us adhering closely to the guidelines and keeping each other accountable. To possibly make sure that there are fewer questions that are asking about the guidelines so there can be more substantive questions, the physical distancing guidelines, the new schedule has been handed out to the members of the media and has already been posted on the internet, in addition to the new regulations which will govern the shelter in place period. Following conversations with the Leader of the Opposition and also His Excellency the Governor, these emergency powers regulations will be tabled in the House of Assembly when the House of Assembly meets virtually on Friday, and it is likely that we will also debate those matters that Friday or possibly at the next sitting. But it's important that we maintain the level of parliamentary scrutiny, and we want to make sure that we can go through these things together. As I have already outlined in phase one, it will no longer be illegal to visit another household. However, it is strongly encouraged that persons do not visit other households. Remember, the more closely we adhere to these guidance and guidelines, the faster we can move safely to phase 2. A curfew will remain in place between the hours of 10 p.m. and 6 a.m. And during that time, it is not legal or it is illegal for you to be in a home that is not yours. Gatherings will be limited to no more than 10 persons. This is outdoor gatherings, indoor gatherings, including private homes. And it is not the time to host parties, as it is an offense to host a group or gathering of more than 10 persons. Permitted businesses will be able to remain open between the hours of 7 a.m. and 9 p.m. Permitted businesses are the only businesses that are allowed to have customers inside of their business. And those are retail grocery stores, pharmacies, banks, gas stations, office of a registered health professional, clinic, hospital, or other health facility, a pet shop with the permission of the Minister of National Security, or a laundromat with the permission of the Minister of National Security. Grocery stores and gas stations and pet stores remain open under the current conditions of lettered days of shopping, and those things will be continued to be prescribed with minor modifications to Sunday shopping. During phase 1, bars and clubs, beauty salons, spas, barbers, cinemas, concert halls, theaters, gyms, sports clubs, restaurants for dine-ins, and swimming pools in hotels, guest houses, and other vacation rental properties will be closed. Retail businesses and restaurants will be permitted to open between the hours of 7 a.m. and 9 p.m. with the following conditions. When it comes to retail stores, customers shall not be permitted to enter the premises. When it comes to restaurants, only one customer at a time shall be permitted to enter the premises in order to collect or pay for an order, and dine-in services are prohibited. Retail stores and restaurants are permitted to make deliveries between the hours of 9 a.m. and 9 p.m., and deliveries can be performed by delivery vehicles from those companies or by taxis and or other public service vehicles. When it comes to fishermen and farmers, licensed fishermen may sell fresh local fish, and registered commercial farmers may sell fresh local produce roadside on Monday to Saturday only, subject to the supervision and permission of the Minister of Home Affairs. These persons may also make deliveries to customers. Playgrounds and outdoor exercise equipment in public parks shall remain closed to the public. This is important as we do not have the cleaning regimes in place yet for those particular items, and therefore, although it is very tempting to allow children to go to playgrounds, they are closed at this point in time, in addition to the outdoor exercise equipment, which is inside of public parks. However, they can run around in the public parks, they can go and run around on the beach as long as they are maintaining social distancing. Regarding boating activity is allowed. However, there are restrictions. Boats cannot have any more than 10 persons on them, and boats cannot have more than persons who are from more than one household on a particular boat. That is specifically expressed inside of the regulations. Additionally, rafting up to other vessels for leisure is prohibited underneath the regulations as is prescribed. So this weekend is not the time, even though the weather is bad, this weekend, during the week, or next weekend is not the time to try to have that party on the water. We are not there yet. Construction, mechanical, landscaping services, and other trades can reopen with strict physical distancing, Minister of Health. Guidance will be released which will require all employees and customers to wear masks. Any business or job site not adhering to that guidance will be closed. The public service will continue to work remotely, but limited public-facing services such as cashier, counter services will reopen on Monday, May 4th for such areas such as TCD, the Office of Tax Commissioner, and the cashiers on the ground floor of the Government Administration Building and the Dame Lois Brown Evan Building. The head of the public service has advised that permanent secretaries and heads of departments have developed plans for the phased expansion of government services commencing Monday, the 4th of May. These plans will see public officers who are not able to work remotely returning to their workplaces under physical distancing guidelines. In some instances, this will require public officers to work in rotation. There will be limited public access. Government's union partners have been engaged for their input, as well as to discuss any proposed plans with them. The priority is to ensure that necessary precautions are in place to keep public officers safe and healthy. And department heads are now discussing their revised operating plans with their staff. Laundromats will continue to operate under the current restrictions, and they will be able to operate between the hours of 7 a.m. or 9 p.m. The new law still requires employers to allow their employees to work from home if they are able to do so. Businesses that are requiring workers to come into the office when those workers are able to work from home outside of what is stated in law may be reported to the police on 211 and are subject to penalties under the law. Parks, beaches, and the railway trails will reopen. Persons may use the outdoor facilities of a sports club, such as a golf course, tennis court, or a sporting field, provided that appropriate physical distancing is maintained at all times and any groups do not exceed 10 persons. There are no contact sports that are allowed. Limited public transportation is set to resume next week, and the schedule will be advised in the current days by the Minister of Transport. Church buildings will remain closed for regular services. However, members of the clergy shall be permitted to enter a church or other religious establishment, providing that appropriate physical distancing is maintained for these two things: private prayer, which is a maximum of 5 persons, and in order to broadcast a service via electronic means, which will include a maximum of 10 persons to conduct the service and to facilitate the broadcast. And that second portion represents no change than what we've been under for the past 4 weeks. We are planning to take a very slow and phased response to reopening the island, which will require constant monitoring of any particular increase in cases. If we see a significant increase in cases based on comparison with our modeling, and if we see that people and businesses are not complying with the conditions of phase 1, unfortunately, more intense public health measures will have to be implemented. And I plead with all persons in Bermuda, do not force us to go in that direction. There are persons inside of our economy who are hurting, who want to get back to work. And it is collectively all of us working together, which will ensure that we can do that together. And for most of this journey, we have stayed together, united in one purpose, united in one vision, and united in one objective. I am very proud of the work that each and every Bermudian has done in your way to get us to where we are, to the ending of shelter in place. As we have reached across the political divide, I am tonight reaching out to everyone in Bermuda for your help. Together, we came through shelter in place, and together we can come through phase 1 and beyond into a new normal where we can return to work, children can return to school, and our lives can return to some semblance of normality. Please keep the family of those who have lost loved ones to this disease and those that are battling with it as we speak in your prayers. Finally, tonight, I know that there are those who feel that their work and contributions to our efforts have not been recognized. With the sheer number of workers, organizations, bodies, and people involved, it is almost impossible to thank everyone without leaving somebody out. This does not diminish your worth, your value, and your contribution in any way. If you or your colleagues feel that you have not received the recognition you deserve, if you feel that your name has not been called as it should have, I am truly sorry. As a Reverend Jesse Jackson once said, charge it to my head and not to my heart. For while we are in positions and situations of fatigue and stress, our minds may sometimes fall short. But each and every the third sector services, the persons who are out delivering food to our for everything that you've done to get us to where we are today. When this is over, we will all have a time to collectively lots of work to do before we get to that point. So today's press conference has been long. There's been a lot of information, and we're looking forward to answering any questions that persons may have. Please note that the government website, coronavirus.gov.bm, has been updated with the physical distancing guidelines and the closure schedule. In addition, the new regulations, which have been sent to the governor for his publication, will also be put on the government website, bermudalaws.bm, so all persons can see exactly what the regulations that are in place for this next phase of operations will be. With that, I'm happy to take any questions that members of the media may have.
Good evening, Premier, Opposition
Mr.
Leader,
Lassio.
and Ministers. Good evening. Thank you. My first question goes to Minister Keynes. On Thursday, you mentioned all the amazing and positive experiences that were happening at the CBA shelter that were really great for the community and for those persons, I'm sure. So my question is, where will those persons go come May 2nd?
Thank you for the question. The shelter will remain open, but it will transition to, as it is now, as it is presently constituted, it's 24 hours a day. So that means they have the men and women at the shelter. They have activities during the day, food during the day, and they transition into a nighttime shelter. But putting it in context, during the day, they have the benefit of nursing staff. They have the benefit of staff from one of our ministries, as well as they are taken care of in the day with food. That is the only thing that will be a bit different. We'll still do all the nighttime activities where they will have the benefit of shelter at night, a meal at night, and the benefit of the care services. In the day when they leave, they'll be given a care package and food to take with them during the day.
Thank you. Is there a date when they will leave already put in place?
We are still working through this. As you know, we're doing this in a phased approach, so we do not have a date to end. The main effort we have is that we realize that these are members of our community. We want to wrap services around them. A good thing, and I shared this last night, is that we see a number of people transitioning away from alcohol abuse, transitioning away from drug abuse, getting the mental health services that they need. We're trying to look at a plan to wrap these services around for the long term. This is where we see green shoots of hope in the shelter, and we want to build on that to make sure our men and women get the support that they need, but transition to more positive lifestyles.
Thank you. My next question goes to you, Premier. During the shelter in place, ferries and buses were not operating. Also, many government buildings were not operating. And I know a lot of people have been talking about how much money the government has spent, but I'm curious to know how much government has saved due to those things being shut down.
Well, a lot of the savings have also been directed to spending in other areas. And I'm not going to be able to give accurate figures from that. But one of the things that is noted that when Parliament returns or the House Assembly returns next week, Friday, or in 2 weeks when we meet, I want to make sure that our ministers can outline the expenditure to date, because it is significant in a number of measures. In order to acquire all the PPE of which we've had to acquire, in order to acquire some of this testing equipment of which we've gotten, it's not been cheap. And so there's been a number of things, dollars that have been spent. But also there's dollars that are saved. So when you don't have a May 24th parade, when you don't have government buildings open, you're saving electricity costs and other types of costs, et cetera. But I don't want it to be thought that public officers are not working, because we're not able to have press conferences like this, issue unemployment benefits, engage remote learning, make sure that certain activities can continue, trash collection, et cetera, without the public service working and operating. We will be meeting with union leaders on Monday, the Minister of Finance, the Minister for the Cabinet Office, and myself, insofar as discussing where we are going forward and to discuss the difficult challenges ahead when the government looks at putting together what our revised budget outlook and projections have to be. And there are going to need to be savings from across the board. And so we're going to try to make sure we approach that process in a collaborative fashion.
Thank you. My next question is, when shelter in place is lifted, a number of Bermudians will most likely want to go to the beach. So the first thing I want to know is, will there be a number limit to how many persons are allowed to be at each beach in Bermuda? Will people be monitoring that, at least for the first day?
You want to take that one? What I will say is that from the perspective, there are not inside of laws prescribed numbers of persons which are allowed at a particular beach at any one time. The fact is that you cannot be in groups of more than 10, and you have to maintain the physical distance as is being laid out inside of the regulations. If we find a place where persons decide that they're going to host a party on a beach or something else, the police will come, will break it up, and it'll be handled in that manner. We're asking persons to make sure that they are wise in this regard.
My affirmative to that. The Bermuda Police Service do have a plan that centers around policing common areas such as the parks and our beaches, and they will be looking at specifically a specific team that will go out in that regard.
Thank you. My next question is actually for the opposition leader. So there have been a lot of social media interactions that have spiked since shelter in place. And a lot of my followers and people are curious and wondering, why hasn't your party joined the interactions on social media as a means to communicate?
If you would notice this week, you'll see that we just opened up a WhatsApp page that has been flooded with all kinds of conversations and observations and questions as to how we move through this virus. One of the challenges will always be when it comes to social media is ensuring that we get proper information out there. We have put a lot of articles out there. We have done a lot of TV, and we're looking now to do more radio, but you will see more of a presence of us on social media for sure.
Okay, thank you. And my last question actually goes to you, Mr. Premier. I would say, can you please just state clearer and more positive for my generation, to be quite honest, is that a lot of us are concerned that when you say a max group of 10 persons, that they don't understand that you still have to be, wearing a face mask and physical distancing. So can you please just reiterate the importance of that, even if you're meeting with people in a max of 10?
Mm-hmm. The importance of this is that if we do not observe the things which are necessary and required to keep this virus at bay, we will see another flare-up of the coronavirus on our shores. And another flare-up of the coronavirus means that, number one, there'll be more persons that are put at risk, which could lead to more deaths, which is something that none of us want. But number two, it might lead to us putting additional restrictions back on certain sectors of the economy, which will harm us all collectively, and that is not something which we want to do. Though you are allowed to be a little bit more free, this is not a path for unlimited freedom. The law is very clear. It does state groups of no more than 10. It does state that whenever you are in any type of group and or gathering, that persons have to practice physical distancing, and it actually spells out 6 feet inside of the law. And any violations of the law are an actual offense. So it is very, very important that persons follow the rules which have been laid out, because if we do not follow these particular things, we can put our country at risk again. We have come a long way. None of us want the last 4 weeks spent in shelter in place to be a sacrifice that was not worth it in the end. And the only way in which we're going to be able to continue is if persons follow the rules and do not start breaking them.
Thank you. Good evening, everyone, and thank you very much. Fiona McWhirter from the Royal Gazette. First of all, for the Minister of Education, if I may, has there been any consideration given to extending the school term, ahead of the summer break?
The only thing that we've been talking about is how we can continue with our remote learning and enhance that product to our students, as well as preparing for the eventual reopening of our school buildings. If it comes down to having those types of discussions, those are things that our team at the department will consider, but it is something that will have to be done in consultation with our stakeholders and the particular unions.
Thank you very much. And likewise, at the point when the school buildings do reopen, what considerations have been given so far to, I guess, physical distancing or perhaps mask wearing for pupils and teachers?
Okay, we have been, as I mentioned in the statement, we've been working very closely with the Department of Health and developed particular protocols and guidelines of what it will look like, or what it should look like, or what it can look like. So we have these things worked out, but we are committed to ensuring that the safety of our students, the safety of our educators is of paramount. And so when we do finalize those protocols, they will have the sign off of the Department of Health, and it will govern how we enter our buildings, how we move around when you're inside the building, and how you exit the building as well. And so and as you did mention, there are everything that we're looking at, temperature, mandatory temperature taking, will they have to wear masks within school, how the hand washing regime will be, will they have to disinfect their shoes before they walk into the building. So there are a myriad of things that we are looking at and to consider as we move forward. But once we have that plan finalized and completed, it will be made public so the public knows exactly what it is they expect when they walk into our schools.
Thank you very much. Greatly
Sure.
appreciated. Minister of Health, perhaps Premier as well. Minister, I think you said earlier that you were increasingly worried that you'd been hearing people talking about planning parties and gatherings, maybe either or both of you. How do you think the message has been received so far over the past 48 hours since we heard about what phase one would include?
Thanks, Fiona, for that question. I think by and large, the majority of people get it because many people have either been in quarantine for 6 weeks or 4 weeks, depending on when they arrive to Bermuda, or alternatively, because of the last 4 weeks of the shelter in place. So I think by and large, most people understand and appreciate the significance of the measures and the significance of ensuring that we continue the controls and the mitigants that we've been exercising heretofore. However, there is a segment of the community, I think, that's become a little bit more relaxed and perhaps feel that the lifting of the shelter in place gives them license to perform in ways that would not necessarily be desirable, particularly because we're talking about people's health and safety. And I think if there's any message that can be delivered or received this evening is the fact that, you know, this is all about our safety. And the reality is that we have been very, very fortunate in our community that we have not seen community transmission, sustained community transmission, which is happening in all other jurisdictions. However, the reality is that notwithstanding that we have magnified our testing capacity, the reality is that we have to ensure that we adhere to our interventions and the mitigants that we've been speaking about, the physical distancing, the wearing of the mask, non-congregating, notwithstanding that the law has changed insofar as you can have gatherings up to 10. As the Premier and I've indicated, particularly because of a public health reason, there's no need to do that. We're not trying to encourage you to do that. And if we see that we have more transmission and increased hospitalization, we're going to end up right back where we are today, which is probably more drastic measures such as sheltering in place. So unless it would be a shame that the last 4 weeks are in vain. And we're just hoping that persons will take these messages seriously to heart because we're protecting ourselves and we're protecting our loved ones.
Appreciate that. Thank you very much. And my final question is for the Leader of the Opposition. We've heard tonight there's been a good deal of, I guess, collaboration and, you know, working together when possible. Mr. Cannoneer, how do you think, maybe on reflection, so far the government has handled Bermuda's place in this crisis? And is there anything in particular you can point to that you might have done differently?
We're in uncharted waters. Hindsight is always 20/20. What I can say is this, is that from the very beginning, a bipartisan approach was needed to this COVID-19. And so we will continue to focus in on how is it that we proceed from here to ensure that Bermuda gets the best from us as politicians. I certainly do not want to politicize. We are not in a debate this evening. We are here out of support to ensure that we do the best that we can for Bermuda. I recognize that it is important that everyone have a voice at the table. And as I mentioned earlier on our WhatsApp page, it has been very evident that there are a lot of questions that people have and observations. It is also very clear that this week the government reached out and offered a position with our shadow minister, Ben Smith, to be on the EMO, to sit in on the regulations that were being discussed and the likes. So this week marks a new forward for us in bipartisanship in ensuring that we get to the table, we're at the table, giving our voice, and I'm grateful for that opportunity.
appreciate that. Thank you all very much.
Good evening. Health Minister, any thoughts about, and I'm going to probably butcher this name, remdesivir, the drug touted by Dr. Fauci and others that was given emergency approval by the FDA this afternoon?
I'm not going to say all bets are off, so to speak, because that is certainly something that I think was alluded to by Dr. Richmond when he was here the other day, and he spoke about the need to look at other options and certain options, particularly that are coming on board that are FDA approved and so forth. No cards are off the table, so to speak, if I could say that. And also Dr. Peakball has also shared similar happening and what other countries are finding successful to see whether or not those same strategies can be implemented in Bermuda.
What is the
on this particular issue? I do know that there was a request which came to myself to try to action on behalf of the Ministry of Health to go ahead and to actually see if we can procure some supplies of remdesivir. And this was actually 2 weeks ago. So that request was put in for looking to procure. And that came from my office to try to get some higher level contacts to see what supply of remdesivir we could procure. Of course, remdesivir exists because it was, I think it was used for, I'm not sure what it was used for previously, but it was previously used for, I think it was used for Ebola actually. And there are supplies that did exist. We tried to get our hands on some, but clearly it's going to be a little bit more challenging now that emergency use approval has been given. But as we've seen, the production will ramp up. And as long as we can maintain our physical distancing, as long as we can maintain control of this virus locally, there will be more supplies, and certainly we'll be able to get our hands on some of those in the near future, I do hope.
Thank you. Health Minister, what is the current R rate for Bermuda and what direction is it headed?
Pardon me?
What is the current R rate for Bermuda and what direction is it headed?
Well, when we reviewed the modeling last week based on Imperial College London, you'll see that there were 2 R ratings. The worst case scenario was R at 2.4, and the best case scenario was R at 1.4. But what we have done is that the Public Health England has also partnered with Imperial College to provide the modeling, and we were able to have Public Health England release the code, so to speak. So we've got online certain of Bermuda's top mathematicians and statisticians working to actually implement and input and Bermudianize, so to speak, the model so that we can see what our dimensions are and what can be utilized for providing different variables, the Bermuda context, so to speak, to see how those factor out in the long run if X then Y, so to speak. But that code was released on Tuesday, and Epidemiology and Surveillance Unit have been in discussions with Dr. Miners and Aaron Evans to assist us with respect to getting more information concerning our rating for Bermuda.
All right, thank you. On Wednesday night, you were very humble and you apologized for not releasing the official numbers at the end of the day on Tuesday, and you said that you would work to get the daily numbers released on a timely basis. The official numbers are still slow in coming out for the public to view on the government's website. Why are the official numbers not automatically updated daily and on a timely basis?
Those official numbers are updated daily, and they're done manually at this point. We do have a software that the Premier spoke about and I've spoken about previously that will help to facilitate that. At this point, it is done manually, and upon receipt of the information, then they're keying it in. Our hope is that because the Go data has been from the back end, persons are doing whatever they do, and I'm not a techie, but I've been told that the back end is being done. and that we are training up persons to be able to operationalize it. So our hope is that we will be able to produce the data on a more timely basis. I think what's more important is that it is coming out daily.
All right. Thank you.
I will accept some of the responsibility for that, because once it's done, then it comes to myself, and I need to make sure that the approval is given. And I ask questions with anything prior, so we are aware of fully what the situation is. So I also accept a small measure of that as well.
Thank you. According to the model on the NPI page, 1 in 4 people will not adhere to social distancing with our most vulnerable residents. What factors were considered in estimating 25% of the population would not take the necessary precautions with our most vulnerable?
Like I said, those figures were based on the modeling assumptions from Imperial College. They actually looked at all Caribbean countries, and they put the assumptions together with respect to the model. So the Imperial College actually built those assumptions into the modeling. However, like I said, the modeling is currently being Bermudianized, so to speak, by those individuals that I've spoken about now that the code has been released.
Thank you. Last question for both Mr. Premier and Mr. Cannonier. With this joint partisanship working through this crisis, what would the two of you hope would format going forward, once we get through this, that working relationship?
What are you expecting from here on? Is that what you're asking? I'm not sure.
Well, you have a spirit of cooperation right now. Everyone's
Yes.
trying to row in the same direction.
Mhm.
Once we
Sure.
get through this, what do you think? What are you guys going to take as positives and a built relationship with each other that's maybe going to help our
Sure.
government run more smoothly going forward?
Conversation that the Premier and I have had this week, a few of those conversations, including today, really has pointed out the fact that many times when we have questions, I think they are assumed to be loaded with other agendas. My agenda is to do the best for Bermuda. And I recognize, after talking to the Premier, I understand that his agenda is to do the best for Bermuda. What that means in a democracy, however, is that it does not do away with questioning. It does not do away with hard conversations. But what we must do away with is these agendas that assume that just because a question is asked by the government or the opposition, that it is coming from a racial background or tip, that it is coming from an economic background, whether you be in any particular stratosphere of the economy. It is solely to do what is best for the island. And as the Premier and I move through this new phase, I'm sure that there will be greater opportunities for us to continue to work together. This virus has highlighted, doesn't matter which part of the island you come from. It doesn't matter whether you're black or white. It wants you. And every single person in this island is precious. And we need to do everything possible to ensure we do the best for Bermuda.
Thank you. Don, it would come as absolutely no surprise, as I said previously before, that it is not easy for me. And it was, I think, the opposition leader and I actually shared a few laughs on Monday because we have been bitter political rivals on the front line of politics, especially when he held the position in which I currently hold, and we were in opposition. So it's not easy. But the fact is that none of this is particularly easy. And I think what is most important is that if we are going to spend our energies and efforts fighting each other versus having our collective energies used together to fight this disease, then the country is going to be the worse for it. And so I would just hope that in this particular process and in the trust of which is possibly engendering and allowing us to possibly build between the two of us, which is far from perfect, but it's getting better, that it might be able to help and benefit the country as we move through the next phases. And that's what we hope. It's a work in progress. It's certainly not easy in any way, shape, or form, but that's what happens when you are part of a system where we have been pitted against each other for the last 10 years.
We both have a common goal. That's to get a haircut.
Thank you very much.
Good evening, Trevor Lindsay. Premier, this question is for you. Premier, the community is alarmed. Members of the community is alarmed at the fact that we in Bermuda, we started this shelter in place with very low numbers, which was expected, positive numbers, which was expected. You've ended the shelter in place with numbers still rising. Do you think this is a good move?
I fully support the ending of the shelter in place. If I did not support, we would not be doing it. And I think that it's important to take everything in the context of what we have. Certainly, we've seen a number of imported cases which are reported. Those are things which you'd expect. We've had 2 outbreaks inside of 2 particular nursing homes, which is something that is of particular concern. But if we look at a broader level outside of those 3 particular case and instances, and if you look at the very large screening exercise that has been done on our essential workers, that would indicate that by and large, we've been spared any type of community transmission from this particular virus. And so from that, we have to move to the next phase, which is making sure that we continue to maintain social distance or physical distancing. But I don't think that, and the premise of your question is coming out of shelter in place as though if we're going back to normal life. We are far from going back to normal life. But I think that we can take this next phase, and if we're able to exercise caution in this next phase, then we can see what it's like to move to the following phases. As it is very, very important of us to make sure that we are following through these particular efforts. But I do not accept the premise of the question that it is a mistake for us to move to this level. Persons may be able to criticize in any way, shape, or form, but from our perspective, it is the right move at the right time, and people are not going back to where they started. But it is important for us to understand that we are still in a very difficult and delicate situation that can change at any time. It only takes one person, and I can just be clear, it only takes one person who doesn't feel as though if they can wait to get a haircut to invite their barber over to their house, and their barber cuts their hair, and someone in that house is sick, and they go to another house and go to another house and go to another house, and then we have a spread. And it is particularly important that we recognize that any move that we do outside the rules and regulations can put the country in risk. So yes, allowing persons to do more things does increase the possibility of that risk. But as a country, we have to be each other's keepers, and we have to know and recognize that anything that we do can set us collectively back. And that's the reason why it's so important for us to make sure that in this next phase, we do what is necessary so we can advance.
Just to reiterate that question was just to calm the community's concern. That's where disseminated from. Another question, Premier, can you explain why the curfew has been changed from where it is now and moved to 10 o'clock instead of 7 o'clock? Do you feel you're giving too much leeway for the public to misuse?
I don't feel that we're giving too much leeway. It's a delicate balance. And in conversations inside of cabinet and conversations with the opposition and conversations with all other persons, it's a discussion on what makes the most sense. In this particular instance, where we are, we felt it good that after persons have been cooking themselves for the last 4 weeks, that we allow restaurants and takeout to open just a little bit later, and they can open up to 9 o'clock to get food. And that was the basis of the decision. And retail establishments that can be open on curbside, those ones that do open later, to be open at that point in time. But we still have maintained a nighttime curfew. We think that it's a good balance. If the balance doesn't work, we'll change it.
Thank you, Premier. My next question to you still is, any thought, has there been any discussion about government and civil service taking a pay cut? Other islands in the Caribbean have discussed and made those arrangements. Is that on the table, like I asked before?
As this question is asked continuously, and I think I kind of addressed it when I think Ms. Palacio asked a question speaking about the challenges of which we had collectively. We are sitting down with our union partners on Monday. The fact is that the Minister of Finance, when he was here 2 weeks ago, said that nothing is off the table and he is recasting the budget. We are going to work through that particular process, and we're going to come to a collective place which is in the best interest of the country.
Thank you, Minister of Health. What what is the difference with the Helix lab and the South Lab labs and the um, getting this results? What is the difference between the Helix lab and how fast do you get the results from the two individual labs?
I think the main difference between the Helix lab and the Southside lab is location. The reality is that they both are providing real-time PCR, FDA approved, utilizing real-time PCR equipment. The test results are, at this point, from the Helix lab, the persons that were making the referrals were from their physicians and, or as you would know, the rest homes. However, with respect to the Southside lab, I'm saying Southside lab, I'm sorry, the other government lab at Southside. Those persons, as you know, many of them are essential workers. So they're actually just making an appointment online and then going and getting their lab results. What we're trying to do, as was relayed on Wednesday, is to better operationalize that so that the results can be received electronically. So when a person goes online, they put the name of their physician as well, and then the results are sent to that person as well as the physician. Were meetings held this afternoon as well as this weekend to try to operationalize that. It is, as you can appreciate, it was a great undertaking. There's almost 200 persons that are being tested a day. Some of those persons, as I explained on Wednesday, may not have a physician. So we are intent on operationalizing that, and we are in the process of squaring that circle, as the Premier says. But we recognize, I think more importantly, is the fact that we have the capabilities of doing all these testing. And we're just trying to get some of the glitches out, so to speak, as to how those results reach those persons. But we anticipate that in very short order, that glitch would have been, we would have been able to rectify that particular situation, because discussions are being had as we speak to perfect that particular aspect.
So you would agree that this whole process has been hit and miss, trial and error?
No, absolutely not. What I would agree to is the fact that over 2,500 people have been tested in Bermuda thus far, making us 10th in the world. I would agree to those success numbers.
So why I say that is because the Westmead facility, they received, the tests were done on the patients in the facility. And the facility is responsible for the patients that were there, but they got they received results from outside of from family members, which was a conflict.
I can't speak to that conflict, but what I can speak to is that the Westmeath residents who were tested all would have been notified by their physician, except for, of course, when the press started releasing information before the residents knew and the family members knew. But the process was for the family members, the physicians to be informed, and then they in turn would inform the patients.
Good evening,
What did I
Minister.
say?
Aaron Hill on behalf of Bird News. Minister, on Monday evening, you were asked the following: how much is each lab being paid by the government for COVID-19 testing, and on what basis? For example, are Helix and Southside being done under a set contract, flat fee, or per test performed? This evening, Bird News received confirmation from the ministry that the monthly sum paid to Helix Lab is $92,413. The ministry further confirmed, now that the government lab is fully operational and able to conduct COVID-19 testing, government has moved to terminate the existing contract with Helix Labs to ensure that we continue to have redundancy for COVID-19 testing in Bermuda, while providing excellent value for money for the taxpayer, end quote. Based on this response, I'd like to ask, Minister, is it your view that the original contract did not provide excellent value for money? And if not, why is the contract being revised?
Okay, that is not my view at all. Actually, at the time that we were trying to facilitate on-island testing in Bermuda, prior to that, we were sending all of our testing results, as well as other Caribbean nations, to CARFA, which is in Trinidad. So the turnaround time was between 5 and 7 days. The Premier and the government wished to get online on-island testing capabilities as soon as possible. Through the tremendous assistance and input of Dr. Desiree Spriggs at Helix Lab, we asked her to help to facilitate that process, get all the equipment that was required, the testing, et cetera, et cetera. She effectively project managed that whole process so that Bermuda was able to have accredited on-island testing capabilities. And we were actually acknowledged by PAHU for saying, wow, you're one of the first countries that's ever been able to do that. Fortunately, we now have another lab, a government lab, which Dr. Weldon is running. And that lab is, as I've said, at Southside. And that lab also has FDA-approved PCR real-time equipment and utilizing the same testing mechanisms as Helix Lab. So Dr. Spriggs produced yeoman's work in getting us up and running so that we could have our own real-time PCR testing mechanisms here in Bermuda, as opposed to having to use overseas CARFA. Now that we have a government lab that is being paid for by the government, we felt from an economic point of view that it would be more cost-effective to the taxpayers for us to terminate the contract with utilizing the Southside lab and utilize Dr. Helix, on an as-needed basis, because we need to make sure that we have a redundancy. If something happens at the Southside lab, we need to make sure that we have the capabilities to continue COVID testing here on island, as opposed to having to utilize the CARFA in Trinidad.
And if I may add, Minister, because I think that it's important here. And it's the same point in time that the opposition leader and I are sitting here as well. There's been a lot of speculation about back and forth between the two labs. We are one country, and the testing capability of which we have at the early stages would enable us to make sure that we could possibly detect this particular virus was due to the work of Dr. Desiree Spriggs. She is a consummate professional. I've had the opportunity to interact with her, and certainly the work of which she's done and the work of which Helix Labs has done has been incredible. At the very beginning, we could have been through a point in time where we could have said, okay, let us try to do this, let's try to do that, let's try to do that. And we could have been 3 or 4 more weeks without testing when the entire world was scrambling to try to get testing in place. We were able to get on-island testing in place towards the end of March, and now we have a second option in the country, which is doing us better. We're certainly going to, as the minister said, look to terminate the existing contract and look to renegotiate and to continue to use Helix Labs and also our labs, as it is important to make sure that we have testing redundancy. Helix can go down one day, the Bermuda Molecular Diagnostic Lab can go down another day, and we don't want that. We want to continue to make sure that we have the ability to continue to process multiple tests here on island and to move from the top 10% in the world up to the top 5% of the world and possibly even higher.
So on that basis, is it the rate that Helix is being paid that's being revised?
The actual contract is being revised because we have the capabilities now through the Southside lab to continue to conduct the COVID-19 testing. And there's, as we've seen, we've got 200 people or so that are being tested on a regular basis through that. And for the economies of scale, it would be better for the taxpayers and more cost effective to continue to utilize the government lab as opposed to a private lab.
So just for the abundance of caution, is the rate being amended from the original contract?
It's going to be amended to a daily rate. It'll be because we will utilize it as on an as-needed basis. Those part of the discussions are continuing, but it's not. It will certainly not be on a monthly basis because we won't be using it for a monthly basis.
Grateful. On March 16th, this is for the Minister of Health. On March 16th, the Bermuda Hospitals Board announced the suspension of non-urgent and elective surgeries. And so for a month, some individuals haven't been able to get these surgeries completed. Yesterday, Dr. Henry Dowling, who is head of the Bermuda Doctors Association, indicated that in his medical professional view, there have been individuals who have potentially passed away during the shelter-in-place period for non-COVID-19 related reasons, that but for the restrictions to access to healthcare caused by COVID-19 related shutdowns might have still lived. As you know, situations go from non-urgent to extremely urgent without warning and oftentimes are too late. Against that background and recognizing that tomorrow we will lift the shelter-in-place regulations, Minister, what has your ministry in conjunction with the BHB done to ensure that individuals will be able to access non-COVID-19 related healthcare issues and have that access?
I think, Aaron, with respect, that's a question that's probably more suited for BHB. But what I can say, as has been reported previously, is that for emergency surgeries, cancer surgeries, as well as urgent surgeries. Those continue to be, they continue to take place at the hospital. Elective surgeries, they have reduced because for obvious reasons, they need to ensure that they have their staff that are, we're in the middle of a pandemic. So with respect, if, I don't want to make tongue in cheek out of it, but if there's an elective surgery that I would prefer to have for various enhancements, I think those are things that could perhaps wait because they need to utilize their resources appropriately. And for emergencies, urgent matters, cancer surgeries, as well as those type of matters, they would reserve their resources, human and physical resources, for those type of matters.
Thank you. Mr. Premier, over the past month during the shelter in place, Bermuda's homeless population has been housed at Barclay Institute and Cedar Bridge with access to on-call nurses and updated information. Some have said that the homeless population have been better taken care of under the shelter in place than they were prior. Now that the shelter in place is being lifted, what will happen to our homeless population, and will the government begin to take a more aggressive step to address the many issues that we're facing with respect to regular testing, housing, and treatment of our homeless population?
Well, I think that the Minister of National Security spoke to what's taking place in the future from the shelter. But allow me to just say this. The very fundamental premise of the question is, are homeless persons being taken care of better under shelter in place than not? The answer to that question is yes. And the answer to that question is because if we have a shelter in place regime, we made the decision that we're not going to leave our homeless persons out on the street at a point in time when we're telling everyone to not be out on the street. So that was the decision of which we made. But the fact is, it's also important to remember that in our budget this year, which started on April 1st, there was additional provision in that budget for homeless services. And we spoke very specifically about that when we laid out our budget. That is something that is necessary because we believe that it is important to go ahead and make sure you take care of the homeless population, making sure that we are providing the services of which are needed in that case. But I'll let the minister follow up.
I think, Aaron, oftentimes we want to look at the government as the end all and be all of everything. And clearly that cannot be the case. The government accepts that it has a responsibility and we will stand up for that responsibility. I've spoken with the minister responsible for this element, and that is the Attorney General. And she and I have been speaking about this and working towards this so that, you know, the Corporation of Hamilton has led a body of people with government agencies, and there is a long-term plan in place to look at opportunities for us to better deal with the unsheltered population. I also believe that we have a number of different entities and we all have to row in the same directions. And what does that mean? We have churches, we have civic organizations, we have social organizations, and the third sector. And we cannot just rely on the government for this. We will lead, but this as a country has been the sentiment that has been echoed tonight, that clearly we need to work together on this endeavor.
Thank you. Premier, the Auditor General, Ms. Heather Matthews, issued a statement earlier this week, and although she recognized that extraordinary measures are necessary, she yet urged sound financial management during this time. Against that background, given the rate of expediency in which unemployment benefits have been processed, which to date exceed 5 million, what measures has this government determined will be necessary for a proper reconciliation of those funds? So, for example, will you be requesting an independent audit of the processing of those payments in order to probe for any potential violations such as double payments, collusion, or fraud?
Thank you for your question. That matter has already started, and the Ministry of Finance has already brought in an outside accounting firm to make sure they are overseeing the process and auditing the process, as we know what will come down the road. But I think that it's very, very important at this point to note that in a time when there is an emergency, sometimes you do not have the benefit of waiting for 3 or 4 quotes or to waiting for people to get back to you. That's just a fact. And that means that people could die. That is the same case of the instance when we went to on-island testing. That's the same case of instance when we went to making sure we had this unemployment benefit. And that's the same case of instance when it comes to certain items insofar as making sure that we got the correct personal protective equipment and other things that are coming to the island. Now that we're in a less urgent stage, those facts and making sure that we get the multiple quotes and making sure that those particular financial instructions that are necessary to provide sound financial management will be followed. The Minister of Finance is very careful and very attuned to the need for this. And we're going to make sure that that is continued. And the Auditor General is happy to play her particular role inside the society. But I'm just going to be very crystal clear that I will not allow people in my country to die because I'm waiting for 3 quotes.
So this is the final question, Mr. Premier. The Health Council has released a statement indicating that health businesses that are not registered with the Health Council are not considered essential. If these health businesses would like an exemption, they must get it from the Minister for National Security. Can you please advise the public why the Ministry of Health isn't responsible for determining whether or not a health business is essential enough to receive an exemption? Would you agree that it would be better placed for the Minister of Health to determine whether or not a health business is essential?
Well, that's a number of questions in one, but allow me to say this. The law, as you know, Aaron, as you're studying law, is very clear. The law in and of itself, it says, if I can, here it is. It's right here where it says very particularly insofar as the types of businesses which are allowed, says the office of a registered health professional, clinic, hospital, or other health facility. But you are incorrect insofar as stating that those particular items need the permission of the Minister of National Security. That might have been the place previously, but now that we're under a new regime, that is not the place. The only place where a permission from the Minister of National Security is required to operate is in the case of a laundromat and or in the case of a pet store are the only 2 places that require the express permission of the Minister of National Security underneath our new emergency powers COVID-19 continuing precautions regulations 2020.
Thank you.
Is that it? All right. So I guess it's time for closing. Just a few things. First of all, I hope that everyone has a wonderful weekend. Our next press conference will be back here on Monday, where we'll have the pleasure of re-entering your homes to share the latest updates. Just a few matters of housekeeping. Number one, the Minister of Home Affairs, the Deputy Premier, has changed the regulations. We do know that we extended the consumption of lobsters for the month of April. However, given that restaurants were closed for just about the entire month of April, the selling of lobsters is still allowed until Mother's Day. So lobsters are able to be consumed in the country until the day after Mother's Day, Monday, May 11th. And so I'm expecting that we'll see a lot of lobster specials pop up over the next week. And for those mothers, you'll be able to have a lobster for Mother's Day, which is something that you probably have not been able to have for a very, very long time. Tomorrow, the Minister of Finance will be hosting a Facebook Live chat, and that will be tomorrow at 7:30 p.m. on the Government of Bermuda's Facebook page. I'm certain that there are a number of persons who will have questions for the Minister of Finance about the economy, unemployment benefit, and other things, and he will be available to take your questions and comments online. Third, I would ask that all persons make sure to refer to our website, coronavirus.gov.bm, for the up-to-date information. Including in there is the new physical distancing guidelines, which give a point-by-point listing of the businesses which are open and are closed and the restrictions of which apply to them. It is incredibly detailed, and you'll be able to get all the information and answer all the questions of which you have there. In addition, the actual law, which is the emergency powers COVID-19 continuing precautions regulations, has been posted on the government website, and we'll make sure it's there so you can take a look and understand all the necessary provisions in law which are required to operate underneath this particular point in time. I also ask you to make sure that you subscribe to the government WhatsApp. That phone number is 504-6045 in case you have any questions or would like to receive up-to-date information on your WhatsApp from the government of Bermuda. In closing, I'd like to thank all of the ministers here, thank the leader of the opposition, thank all of the members of the media who continue to make sure they do their reporting and continue to ask the questions and probe us as we get our information to the country. I ask that all of you to please take care of yourselves, and remember, tomorrow morning at 6 a.m. is not a license for you to go ahead and act as though if you acted as though we did not have a pandemic that is continuing to affect the entire globe. Now is not the time for us to lose our composure. Now is the time for us to demonstrate our composure and to as a country that we are going to act right and we're going to take ourselves into phase 2. So with that, I want to tell everyone, thank you and good evening.